Good afternoon. Happy Wednesday. This is Dr. Barry G., also known as Houston's Dancing Psychiatrist, reminding you all again that the next classes are going to be Friday morning, EOS Fitness in Meyerland, Aqua Zumba, Friday night, Land Zumba at Eldridge and Briar Forest, that's LA Fitness, Saturday mornings, Aqua Fitness in Pearland, and Sunday mornings, Land Zumba on 12340 Barker Cypress, LA Fitness. That being said, today we're going to be talking about oral ingestible lavender oil for the treatment of generalized anxiety disorder. So we're going to be talking about a supplement that is not FDA approved for this purpose, but there is good data to discuss it, and it is something that I do use in patients at times for the treatment of generalized anxiety disorder. Generalized anxiety disorder is a condition in which people are excessive worriers. Once they start worrying, they have difficulty controlling the worry. They struggle with symptoms of insomnia, irritability, muscle tension. So these are kind of things we think about. So I'm going to be talking about a drug called Silexin, or ingestible lavender oil capsules. And multiple randomized controlled trials have demonstrated efficacy for it. And in 2023, there was a meta-analysis of 5 double-blind controlled studies that were done involving 102,013 patients who had subthreshold anxiety. They also had generalized anxiety disorder and depressive disorder. And this study from Europe showed that Silexin, or oral ingestible lavender oil capsules, at 80 milligrams daily for 10 weeks was superior to placebo in reducing what's called the HAM-A, or Hamilton Anxiety Rating Scale, which is a score that's used in research studies for measurement of anxiety efficacy. It also reduced the patients also reported a self-report improvement in anxiety. And the patients were felt to be 1.5 times more likely to have reported also improved mood. So while it is not FDA approved for mood, the fact that patients have depression with anxiety, which we see a lot, the presence of depression does not rule out the usage of this. There were some comparable efficacy studies looking at this drug, meaning ingestible lavender oil capsules, with Paxil, or paroxetine 20 milligrams, which is an SSRI. And a study looked at paroxetine, Paxil, zero point 0.5 milligrams of Ativan a day, or 20 milligrams of Paxil, versus oral ingestible lavender oil. And the lavender oil patients showed consistent efficacy with those two medications, but of course the side effect profile is different than those two medications too. The most common side effects seen were upset stomach, nausea, but no significant difference that required people to discontinue the trials. When I've used it in my practice, what I've seen is ingestible lavender oil burps as the most common side effect reported. And what's also interesting, that these medications, i.e., the ingestible lavender oil, was not associated with sedation and the drug-drug interactions that you can see with drugs like that are in the SSRI family or SNRI family, and also the sedation and potential addictive potentials that you see with the benzodiazepines. The question is, what is the mechanism of action? Why does lavender oil work? Not clear, but it may be severalfold. Number one, it might be mediated by modulation of voltage-dependent calcium channels, and also maybe some intracascular cascades involving protein kinases. It also probably has an influence on serotonin, norepinephrine, dopamine, because when you affect one neurotransmitter or brain wiring system, you indirectly affect the others. It also may help with something called CREB, and via activating a transcription factor called CREB, it may act in neuroplasticity, and we think neuroplasticity is involved in brain integrity and brain strength. So what's the take-home message from this longer-winded than I normally give talk on it? I want to remind you all that ingestible lavender oil is NOT, not FDA approved for generalized anxiety disorder, but there is good data to support usage of it. It's why I do use it in my practice and do talk with patients about it as an off-label option. Remember that this could be a reason to initiate a conversation with your clinician regarding the above. It is not a prescription medicine. It is available over the counter. The way most of my patients get it is via Amazon, via a product called Column Aid. But once again, don't want you doing this without talking with your clinician about it. But it does represent another choice for anxiety relief for the patients who have generalized anxiety disorder. And what I like about it is these are patients who either can't tolerate the SSRIs, don't want to be on antidepressants that have anti-anxiety properties, or as a non-benzodiazepine, non-Xanax, Valium, Ativan approach to it, with a side effect profile that Warren's talking about. Longer video than I normally give y'all, but I've been having this for a while. Wanted to talk with y'all about this, and Dr. Barry G, Houston's dancing psychiatrist, wishing y'all a great day.